Well, thank the Senate for letting me address them today at lunch. The President and Vice President, who visited as well, made some comments that were hugely beneficial to explaining the scope of this bill. And I want to be very straightforward with a simple comment to start it all off with. This is the most ambitious health reform bill ever in our history, and it could not come at a better time. We have an unstable market that is causing lots of potential peril to Americans who need our help the most. The most vulnerable amongst us were the ones who will suffer the most if we don't get this bill through. It is investing $200 billion more money, roughly, over the next decade than what is the current level of spending. It is true that it's not going to go to the $1 trillion of spending that would otherwise occur. And how is it going to do it? Well, it's going to do something very important. It's going to curb the growth of Medicaid, which is right now has changed 50% in its expense over the last 5 years by doing a few things, including reduction of fraud, waste, and abuse, an aggressive program to make sure that the right people who are eligible are truly adjudicated to be just that, eligible. And the work requirement is part of that equation, ensuring that what is good for the individuals, what's very popular amongst the American people, the idea that you should be trying to work or volunteer or get educated, participate in your community in some way. And by doing that, demonstrate that you are trying your hardest to help this country be greater, by at least trying to fill some of the jobs that we have open. And by doing that, you earn the right to be on Medicaid. These programs, we believe we can roll out successfully. We have 2 pilots already using information technology solutions, an app literally on people's phones. 91% of Medicaid patients have a smartphone that can use an app of this nature that would help us identify how many hours you've worked, what you got paid, did you try to get an education, did you volunteer, and do that in a seamless fashion. We believe we can roll that out in 18 months. We already have the head of the USDS, United States Digital Service, Amy Gleason, creating a center of gravity at CMS to accomplish that goal so we can accomplish it within the 18 months that this bill offers. There's lots more to speak about in this bill. It is promising in many ways, but at a summary level, it builds a strong framework to allow us to do the right thing for the American people by allowing these systems to align the needs of the federal government and the president with those of governors and states. By aligning the needs of the federal government and the states, we can serve the American people most effectively. The current system doesn't do that. Between state-directed payments, provider taxes, and other types of legalized money laundering, we're hurting the ability of the federal government to work with states to improve the system. And we know from having spoken to many of these states, these are the kinds of changes that could be beneficial. Thank you again to Senator Thune, the rest of the Senate, for attending the lunch, and to the President and Vice President for letting me speak today.